So, why don't you tell us a little bit about what these papers are? And I should say, for those who are interested in checking them out, we'll put two links in the description. They were both published in BI&T, Amy's peer-reviewed journal, very recently. I think it was on the 16th. So, Karen, just elevator pitch me. What was the focus of this work?
Yeah, so ECRI's been doing testing of disposable isolation gowns since the pandemic started, and everyone started saying, these gowns aren't really protecting us in the healthcare facility, and we were getting a lot of reports to our patient safety network about them. So we really wanted to investigate them a little bit more.
Maybe just in summary, and you spoke so well about it from the survey, you identified a number of areas, I'm going to say, of failure. And maybe you could highlight those from the survey.
Right. So we did both a survey and laboratory testing. So for the survey, we sent out a national survey to healthcare workers with experience both purchasing and or wearing disposable isolation gowns. And we really wanted to see really what selection practices were and then what the healthcare worker experience is. So we really found that from the purchasing side, while there are 4 levels of isolation gowns available, which have varying levels of protectiveness, and you really should be choosing those based on the exposure risk of the procedure that you're going into, really we're seeing that it's usually about 1 level that's actually stocked predominantly in certain areas of the floors, and therefore there's not a good chance for the healthcare worker to choose based on the exposure risk of what they're walking into.
Mm-hmm.
And then we're also seeing that the healthcare worker isn't actually fully trained. About a little over half said that they aren't fully trained on those disposable or those isolation gown levels of protectiveness. They're also not evaluated for competency of wearing. Yeah, so about a third of our respondents did say that they experienced strike-through. Concerningly, some do experience daily or weekly strike-through. So strike-through is also permeation of liquid through the gown. So that would be a potential exposure incident because you're getting it on your skin or you're getting it on your scrubs. Yeah, so even though we see that a third of our respondents are having strike-through, especially if it's daily, weekly, or even monthly, they're not reporting it. We have 50% never report, and another 26% rarely report these issues to their managers or to their occupational health. The second part of our grant study was performing the 2 liquid barrier penetration tests, so impact penetration and hydrostatic pressure, and looking at do these really reflect the conditions of a healthcare environment? Because they were written in the 1940s. They weren't written for healthcare at all. They were picked up in the mid-90s for healthcare because we realized we really need to be testing gowns.
So, what industry did they transfer from? Are we talking about the lab environment or something originally?
It was cotton and rainwear industry.
No kidding.
Yeah.
Oh, that's interesting.
Yeah, so they were kind of the only test methods available at the time, and this is kind of what we stuck with.
Sure.
So they're not necessarily the best equivalent to working in a healthcare environment. The preconditioning is like the humidity is really high in the test method, but really a lot of healthcare facilities, the humidity tends to be really low. Or you're looking at the test liquid is water, and how often are you being exposed to just water in a healthcare environment? So, and also it's cooler than coming out of a human body.
Oh, sure.
So we redid the tests looking at if we dropped the humidity or if we warmed the fluid up to body temp or if we used synthetic urine instead of water. And we redid both of the tests on a couple disposable isolation gowns. And we showed that, in fact, it does have an effect on the outcomes of the test methods. We did see higher strike-through with warmer fluids, which makes sense because it's lower surface tension. So that, to us, means that there would be more fluid going through in a healthcare environment versus in a lab environment.
What do you see as the next steps? Where do we go from here?
Next steps I see as really starting the discussion in the industry, because this isn't talked about heavily enough, and really looking at both the guidance for healthcare workers and also the standards and seeing how we can update them. And that's going to require some more study. So we need healthcare facilities to report these problems. They're not MAUD or MedSund or MedWatch reportable necessarily, but they should be trended internally by your risk management and health and safety, and also report them to your patient safety organization so that we can trend them and talk to the manufacturers about if you're seeing increases in strike through or other issues.
Yeah.
And then also looking at what other ways can we improve the test methods to make them more realistic for healthcare, and that trending of incidents and research into what we can make more realistic will hopefully translate into updating standards and guidance and make those more realistic.
Yeah. And the other thing is PB70, the AAMI document, is going to be up again for review and revision. So the timing is very good for that process as well. And then, it's you mentioned level 1, 2, 3, 4.
Yep.
You and I live and breathe this stuff, so we're talking about what's in the AAMI PB70.
Sure, yeah.
Defines 1, 2, 3, 4,
Right,
and
makes
then the
it clear
FDA
what it's-
recognizes that, as does NIOSH. And then the ASTM methods that you're referring to are test methods to demonstrate meeting the definition of those levels. So we need to up the game on all of those, right?
Right.
Yeah.